Diabetic retinopathy. Do you know that 103.12 million people have diabetic retinopathy, and this number is projected to increase to 160.50 million people by 2045? But many people develop this eye disease without knowing and usually confuse it with other eye diseases. Therefore, in today's video, we shall tell you what diabetic retinopathy is, causes of diabetic retinopathy, and types of diabetic retinopathy. So, stick around till the end of the video, because we shall share with you our best proven diabetic retinopathy treatment. Before we get started, please consider subscribing to our channel because it motivates our team to make more videos like this one and also join our healthy community. Diabetic retinopathy is a diabetic eye disease that can happen if your blood sugar levels are not maintained. For example, too high or too low blood sugar. It affects the retina, which is the thin layer at the back of your eye that helps you see. High blood sugar levels can damage the tiny blood vessels in the retina, leading to vision problems or even blindness if it's not treated. That explains best how diabetes affects the eyes. So, what causes diabetic retinopathy? The main cause is prolonged high blood sugar levels. Over time, too much sugar in your blood can lead to the blockage of the tiny blood vessels that nourish the retina, cutting off its blood supply. As a result, the eye attempts to grow new blood vessels. But these new blood vessels don't develop properly and can leak easily. Despite prolonged diabetes being the main cause, there are other factors that can increase your risk of developing diabetic retinopathy. For example, 1. High blood pressure. Uncontrolled high blood pressure, even without diabetes, can damage retinal blood vessels, but when combined with the effects of high blood sugar, the damage is amplified. 2. High cholesterol. High cholesterol can contribute to diabetic retinopathy by increasing the risk of hard exudates and macular edema, which are complications of diabetic retinopathy. Elevated cholesterol and lipid levels, particularly LDL and triglycerides, can lead to the accumulation of lipids and proteins in the retina, causing damage to blood vessels and potentially leading to vision loss. 3. Smoking. This significantly worsens diabetic retinopathy by damaging retinal blood vessels and increasing oxidative stress, which accelerates the development and progression of the condition. It happens because smoking can reduce blood flow to the retina, causing tissue damage and impairing the body's ability to control blood sugar levels. Not only that, but the chemicals in cigarette smoke can also directly damage the delicate tissues of the eye, including the retina, further contributing to the development and progression of diabetic retinopathy. Members, if you have found this video helpful so far, please give it a thumbs up and also share your thoughts about this video in the comment section below. Continuing, let's take a look at types of diabetic retinopathy. Generally, there are two main types of diabetic retinopathy. 1. Non-proliferative diabetic retinopathy, or NPDR. It is the early stage of diabetic retinopathy, where blood vessels in the retina are weakened and may leak fluid or blood. In this stage, new blood vessels are not yet growing, but existing ones are becoming damaged. Treatment for non-proliferative diabetic retinopathy focuses on slowing or stopping the progression of the disease and preventing further vision loss. Treatment options include laser photocoagulation, anti-VEGF injections, and in severe cases, vitrectomy. 2. Proliferative diabetic retinopathy, or PDR. It is an advanced stage of diabetic retinopathy characterized by the growth of new, abnormal blood vessels on the retina's surface. These vessels are fragile and can leak, leading to vision problems and other complications like retinal detachment. PDR often has no noticeable symptoms in the early stages, making regular eye exams crucial for people with diabetes to detect and treat the condition before it causes irreversible damage. If you have advanced PDR, your ophthalmologist may recommend surgery called vitrectomy. There you have it, diabetic retinopathy explained. Diabetic retinopathy is a serious but often preventable complication of diabetes. By managing your blood sugar, blood pressure, and cholesterol, and by getting regular eye exams, you can protect your vision and catch problems early. Remember, your eyes are your window to the world. Take care of them today to preserve your sight for tomorrow. Thank you for watching. See you in our next video.